you don't mind, let's take questions after we've gone all the way through. Jill Buhler with Jefferson Health.
Hi, thank you for having us here. It's always my pleasure to talk about Jefferson Healthcare. We determined early on that our biggest impact of this is going to be in our emergency department, our clinics, and our family birth centers. So what we are doing, first we are collaborating with Olympic Memorial Hospital and Forks, and looking at how we can share resources, staffing, possibly creating a pool of what we call travelers. They are people, temporary medical people who have been trained in their specialties and who prefer to move around the country and not stay in one particular place. And if we can, but they're very expensive, so we would like to share resources and possibly create a regional pool of travelers to help with staffing over the period of time that we may need increased staffing to offset. And also in the emergency department, we contract with NEP, that is Northwest Emergency Physicians, and they have physicians also based other places on the other side of the bridge. So they are already working on a way to creatively staff and schedule their people so that we'll have a constant pool here on this side during that time. So there will not be any deficit in that. And our new express care has already alleviated a lot of the congestion in our emergency department, so that will also help during that time as well. We expect longer transportation times for transferring patients. It's going to take it could take 6 to 8 hours to go to Seattle, and that's if the roads are clear. If that's Hood Canal, if Hood Canal is going pretty smoothly. So we're looking at the possibility, if it can be done on our side. Of course, airlifting out is always the very last resort, but in an extreme emergency, of course, it's not an option. I mean, it's a will do. But if we can, we're looking at transporting patients closer to home, like maybe Tacoma, and we're looking at Gig Harbor and places like that would be a little bit closer. In the birth center, some of our ladies prefer to go to Harrison to have their babies, but most of those are high risk, and we can't treat them here at any rate. So those ladies, their doctors, their family doctors are working and consulting with them to make sure that they know the alternatives and help them with their plans. And then we are stepping up in the birth center for our own babies that are going to be that are scheduled. Of course, you never know what the schedule is going to be.
Does that mean no sex for the 9 months?
Yeah. I didn't know how to put it delicately. Our clinics are going to have to be able to absorb more patients. So we have already instilled a hospitalist program that employs specially trained, it's a specialty in itself, and it's an up-and-coming thing, where there is a family physician who does nothing but attend to inpatients. And this alleviates the rounds that the other family practitioners normally have to do. So they can now be more free, and they choose to do this, to be more free in the clinics. So that means we can expand the clinic hours, and we will be doing that. So we'll have longer hours in the evening, and during Saturdays we will have about 6 hours available on Saturdays. So this is an ongoing thing. This is not just the bridge closure. And one of the things the bridge closure has done is made us evaluate our services and get a little leaner and get a little more efficient. So in that way, it's been it's been very good. Supplies, we are already working on that. Our purchasing agent has already been in contact with vendors to make sure that we'll have a steady stream of supplies in a timely manner. So we don't think that's going to be an issue unless something big happens on the canal. Even so, a lot of it will ramp up in supplies and to store them, those that are not perishable. Then we're going to have an advertising campaign because we actually view this as an opportunity as well, as once we get over the challenges, we think we might be able to attract those people who are in our community who are not aware of our services, and once they find out how wonderful we are and what great service we provide, they'll decide to make Jefferson Healthcare a medical home. So, their medical home. So, we are going to be engaging in a very extensive campaign to make people aware of our services, to ask for their input and their concerns, and that's our plan.
Thanks.
Thank you.